What options do expats have if they can never use Medicare overseas? If you're an expat living overseas and cannot use Medicare, you still have a number of other options for healthcare. Since Medicare often does not offer coverage outside of the United States, except for certain emergency situations, the following are some possibilities for health insurance that an expat may want to think about. Many expats opt to buy health insurance policies tailored to their needs. These insurance policies cover medical expenses when residing overseas. International insurance providers that provide customized plans for U.S. citizens overseas are available to expats, including IMG Global, GeoBlue, Cigna Global, Aetna International, and Allianz Worldwide Care. With their various degrees of comprehensive health insurance coverage, these insurers let you choose a plan according to your financial situation and medical requirements. Medical evacuation, hospital stays, emergency care, and normal medical care can all be covered by these insurance providers. You can still be eligible for coverage while residing overseas if you are a military retiree and qualify for TRICARE. The TRICARE Overseas Program TOP provides a number of options, such as healthcare benefits are provided abroad through TRICARE Select and TRICARE Prime for retirees. Verifying your eligibility and the particular benefits that apply to you is crucial because coverage varies depending on your location and unique circumstances. If you're registered in both plans, TRICARE usually combines with Medicare, but TRICARE can still offer coverage on its own because Medicare cannot be used in another country. In numerous countries, you can buy local health insurance that covers you only within the specific country. It is critical that you know what is covered by local plans because they may differ greatly, especially in terms of price and coverage. Germany's mandated medical insurance or France's social security system are two examples of national health insurance programs that may be offered to non-citizens for an additional cost. Participation in local healthcare systems may be an option for residents, depending on the country. To learn about your alternatives in your home country, speak with an internationally based expat insurance provider. Temporary medical insurance for short-term stays. Consider purchasing a short-term overseas health insurance policy if you intend to live in another country for a brief period of time. These plans might be appropriate for stays of 1 year or less and are more reasonably priced. Their benefits may not be as comprehensive as those of long-term plans, but they usually cover emergencies, hospital stays, and basic medical treatment. Retirees Medicare Advantage. Medicare Advantage plans may provide some limited coverage abroad, even though Medicare does not cover international medical expenses directly. For urgent treatment and emergencies overseas, certain Medicare Advantage plans include emergency coverage for international travel. This coverage is usually restricted to emergencies only, not routine care, and it frequently requires upfront payment and the filing of claims for reimbursement. This might not be enough if you want to reside overseas for an extended length of time, but it's still a good idea to ask your provider what kind of coverage they offer. How to handle Medicare and foreigners' health coverage and travel insurance. Living overseas requires you to pay the monthly fee for Medicare Part B, which covers outpatient care. In spite of this, you will not be allowed to use Part B and will need to obtain an extra insurance plan to cover medical expenses while traveling outside of the U.S. Medicare Part A. Hospital insurance, which is normally free if you have worked at least 10 years or 4 decades in the United States, may be retained if you intend to return to the country at some point or have brief stays. However, without Parts B or D, your medical coverage would be limited, and you may need to obtain an additional insurance policy when traveling abroad. Travel insurance with medical coverage is an option if you'll be overseas for a short period of time and will need insurance for travel-related problems, emergency medical care, and if required, medical evacuation back to the United States would be covered by this. Health insurance for evacuation. Medical evacuation insurance is crucial for some expats. This kind of insurance covers emergency evacuations to another country with better health care. Medical evacuation is covered by a lot of international health insurance policies. Important things to think about. Duration of stay. The type of insurance you require will depend on how long you plan to be overseas. Local or international health insurance may be the greatest options for long-term relocations. Short-term health coverage or travel insurance could be adequate for shorter visits. Visitors must meet stringent requirements in several countries in order to receive health insurance. To prevent fines or penalties for not having insurance, always verify local laws. In conclusion, even if Medicare does not offer coverage outside of the United States, you still have a lot of good options for healthcare as an expat, such as local plans, TRICARE for military retirees, global medical insurance, and other specific expat health coverage. It's essential to research and select a plan that aligns with your healthcare needs and the regulations of your host country. Thank you for watching. Consider giving the video a like on your way out.